Knock, knock. Howdy, folks. Dr. Ben here. Hello from Nashville Skyline.
Woo.
You're listening to the Dr. Ben and Friends podcast, the podcast dedicated to putting the med in comedy. See what I did there?
There you go.
We're shining a big, bright spotlight on everyday heroes in healthcare and heroes in comedy. We're here in Nashville where the smiles are big and the hats are even bigger. We're glad you're here. Or lost on Music Road trying to find some boots. I'm your host, Dr. Ben, your friendly, board-certified orthopedic surgeon and stand-up comedian. Voted Nashville's funniest comic 2025.
He was, and he is.
Because apparently fixing knees and shoulders isn't enough. All right, today co-hosting with me, we have the innovative Nashvilleian with jokes fresher than my sterile field, filmmaker, comedian, writer, Mr. Seth Kays.
How's it going? Thanks for having me.
Thanks for being here. And I'm excited you're in for a treat today, listener. We have a real-life healthcare hero, Dr. Kate, a multi-talented orthopedic surgeon, a trauma orthopedic surgeon. She's tougher than any fracture I've ever seen.
Thanks. Thanks for having me, Dr. Ben.
All right. Thanks for being here, Dr. Kate. We're going to hear a lot more about what she does coming up. All right. Well, the Dr. Ben and Friends podcast prescribes 100% comedy with zero copay. So today we're celebrating healthcare heroes and comics who dedicate themselves to making the world healthier and funnier. All right, listener, whether you're scrubbing in or clocking out, thank you for joining us. Let's make some noise, or at least some endorphins, for the Dr. Ben and Friends podcast.
Woo, woo, woo.
A special thanks to our sponsor, The Needles Group, in beautiful Marco Island, Florida. As a doctor, I know a great needle when I see one, and these realtors are the best in the business. Buying or selling? Let The Needles Group inject some serious value into your property game. TheNeedlesGroup.com. All right. Well, we have a very talented comedian. You're an actor, writer, filmmaker.
Musician, all
musician,
of it.
Musician. Sounds like a professional overachiever.
Or professional burnout, either way.
Listener, you may know him from his Movie Wars podcast with Kyle Castro, but we're lucky to have Mr. Seth Kays here today.
Happy to be here. I'm excited.
Thank you for being here.
Yeah.
Mr. Seth, Dr. Catherine here is an orthopedic surgery traumatologist. What do you think that means? What does she do?
I mean, so coming from my completely medically uneducated background, I think the most medical education I have is I have seen the entirety of Scrubs like 2 or 3 times. So I have a little bit of that.
That's a
Including
really good
the
start.
reboot?
I haven't seen the reboot yet.
Okay.
I am currently going through the pit. So that's where my most recent medical knowledge has come from. But I hear orthopedic and I know that has to do something with bones, but I always think it has something to do with like teeth. So,
Okay.
Because I know.
Like orthodontist?
Yeah, exactly. Which I know is totally wrong, but I'm assuming you're some sort of bone doctor and it's the bones have probably gone through some childhood trauma that you're trying to therapeutically help them with. So that's where I'm coming from. I'm probably very wrong on this.
All right. Dr. Kate, what do you actually do? What is an orthopedic surgery traumatologist? Do you work with teeth?
Yeah, no teeth
No
for
teeth.
me. I know there's bones above the neck, but
I mean, teeth are bones technically.
yeah, they're bone adjacent, I would say. We've got other very talented people who take care of those. But yeah, I introduce myself to most of my patients as a bone doctor.
Okay.
Just to make things pretty clear. But essentially what I do is I fix broken bones. So any
Nice.
broken bone that doesn't actually walk through the door, usually rolls through the door.
Fair.
We take care of with some sort of therapy, usually metallic therapy.
Oh, okay.
I like that. Metallic therapy.
So you're just blasting Metallica in the operating room.
Sometimes.
Not a
huge
not a
Metallica
huge
fan.
Metallica.
She's more of a
fan, but-
Slayer girl. Okay.
Some surgeons, one of your partners at your hospital, liked it completely quiet. So he complained about the anesthesia machine beeping, whereas some want it to sound like you're at the System of a Down or Korn concert. Where are you? What kind of music do you like in the operating room?
I listen to all sorts of music, but
See, everyone says that, but then you hit them with some sort of
specific genre
metal, and you're like, you don't listen to German death jazz? Like, what are you doing?
Yeah,
death metal.
I mean, right now I'm on like a French EDM kick.
Oh, there we go.
But Billy Strings just came to town, so we had a bluegrass days,
Nice.
Americana. I would say I don't listen to a lot of classical in the operating room. I don't listen to a lot of metal because it's just kind of the wrong feeling.
Right. You don't want like a nervous energy.
Yeah. But it's we go on full iPod shuffle, and there's just kind of a lot of different things on there. And sometimes, not often, I do let my first assists choose the music.
Okay. Do you ever have to change it?
No, I like
just let it go.
I give myself into it.
Okay.
Yeah. So.
All right.
Do you feel like the music like changes the outcome of the surgery? Like do you think it affects that at all, or
I don't think it changes the outcome of the surgery, but I think
you don't think there's a little extra flavor? Like if you're dealing with
samba.
bluegrass, they come out with a little jive in their step.
You know what? I haven't asked that in my follow-ups.
We should do a study.
I'll have to see. Yeah.
Yeah, add that to the follow-up interview.
Yeah. It changes how I feel. So sometimes I'm like, we're in a 12-minute, like African protest song. I was like, we can skip this one a little bit.
Skip. I have a list of band songs from my operating room.
Yeah.
So I'm a little stitious, but anything like Another One Bites the Dust or Stairway to Heaven, Highway to Hell.
Oh, yeah.
So I'm like, okay, skip.
Yeah, I would say a majority of my songs don't have words to them, so I don't worry about it.
You're a vibes girl.
Yeah, I'm a vibes girl.
Okay.
Yeah, even if they have words, I'm not listening to them.
I feel it.
Mr. Seth will have the opportunity to perform surgery later on our show. What type of music do you think you'd listen to if you were in the operating room as the surgeon?
See, I am a metal guy.
Okay.
Like and I am truly one of those people. Like outside of most modern country, I do kind of dabble in all musical genres. The band I have been obsessed with the last couple of years is a band called Sleep Token, and they have like metal's kind of the glue that holds everything together, but they hit everything from like folk to pop to blues and jazz and like all these other genres that they pull into each of the songs.
So they're serious musicians.
Absolutely.
All right.
Awesome. They're fully anonymous too. Like they all go by pseudonyms. They all wear masks. So it's like all about the music and not necessarily about the people doing the music. So
wow. Okay.
Yeah.
Love it.
I'll give it a listen.
They're great.
Give it a listen. Give it a listen, listener. All right. Well, as if 13 years of training for Dr. Kate here, 4 years of undergrad, 4 years of medical school, 5 years of orthopedic surgery residency wasn't enough. She did extra training in trauma to become a traumatologist. So I'd like the Mr. Seth and myself and the listener to hear, what's a typical day in the life of an orthopedic surgery traumatologist? Like, when does your day start? What's the mix like of cases in the operating room, or are you going to the emergency room or seeing patients in clinic? What's the day in the life of an orthopedic traumatologist?
Yeah, so I think the only day that I have set in stone is Tuesdays. That's my clinic day.
Okay.
So I know generally what's going to happen on that day. I'm going to have clinic. That's it.
Tell the listener what that means.
Clinic. That means seeing all of my patients who I've operated on. So I follow up with my patients usually until about 6 months, sometimes up to a year, sometimes longer. It just depends on the pathway that their postoperative course takes. I've got great people who help me in clinic to help coordinate a lot of the care because it's not just about the injury and about what I did. It's about trying to help the patient kind of globally through their injury, because oftentimes I'm not the only person who's operated on them. So just trying to make sure that they're getting the global care that they need. So it is
physical
still
therapists.
or other surgeons
physician.
from our hospital. Sometimes they come in with a cervical collar on and they say, "Oh, I thought you were the person or
treating my broken neck."
Yeah, and I say gracefully that I'm just not that talented. But connecting them with surgeons that they just didn't have the contact information, things like that. So it's a group effort for sure.
And then what about the other days besides Tuesday? What's that like?
Yeah,
a little crazier?
Yeah, a little bit more variable, I suppose.
Variable, okay.
So I split call with 2 fantastic partners, and so we just make our own call. It's not very set in stone. But we're on for 24 hours at a time, 7 a.m. to 7 a.m. And we just essentially take care of anything that Nashville giveth on those 24 hours.
Nashville giveth a lot.
Right.
Yeah. And it's not just Nashville. We have an incredible kind of area that we take care of, whether that's southern Missouri, southern and western Kentucky. So I'm still getting my geography in this area, but huge catchment area. So, sometimes we are the hospital that the patients need. And I wake up about 5 a.m. And
Early.
look at what has come in over the past 24 hours, look at x-rays, CTs, look at their chart, see what other injuries they have, just kind of get an idea of what is going on with each patient. And then I plan for their surgery. So I send our OR staff a write-up of every single case that I'm going to do with the bed, the positioning, the drapes, the where I want the C-arm, the specific plates, nail sets, all the instrumentation or hardware that I need. And then I have a section called other instruments, which is just other things that I may think that I need during the case, just to have everything that I think I may need for that case.
Were these surgeries from the night before or day before? Or scheduled from?
Yeah, I schedule them at 5 o'clock in the morning.
Okay.
So sometimes, if I know that I've got a hip fracture or a femur fracture that came in, I'll actually have those scheduled already. But I set my final lineup about 5:30 in the morning.
Wow.
And I thought an 11 a.m. podcast was early.
Yeah, I've already had a whole day before.
That's why I went into sports medicine.
Yeah, a
Usually
little
don't
bit
have to
different.
get up really early to fix those rotator cuffs, but
Yeah, and I think that's one of the huge differences between your job and mine is that I have a few hours to prepare for surgery, which you can book yours out, 3-4 weeks or
exactly.
and really have time. But that's one of the exciting things about the job that I have, and keeps it spicy,
So tell us about being on call for those 24 hours. What's that like, or what's your role? Are you meeting people out at the helicopter pad, or
Are you in the hospital, or do you get to be home while you're on call?
Both.
Okay.
Yeah, again, it kind of depends. Like if I'm on call on a Tuesday, I'll be in the hospital and clinic.
Okay.
But usually for the daytime hours between 7 and about 5 p.m., we have a group of fantastic physician assistants who kind of take that primary call from the emergency department. And then at night, occasionally it's me, occasionally it's one of the physician assistants. But we don't expect them to make any treatment decisions. They're just kind of there to, say, kind of just understand what the injury is, what other injuries, what's happened to the patient. And then we're always, my phone's always on loud when I'm on call.
Yeah.
So if they have any questions, concerns, then they can ask us directly. Otherwise, they touch base with us around 5:30 in the morning.
stabilize the patient?
Yeah. The general surgery trauma team is the kind of in-house team that's doing that. It's pretty rare that we have to get called in the middle of the night to take care of something. A lot of orthopedic injuries can get temporized with traction or a splint, and we can kind of take care of things in the daylight hours. But certain things we do have to come in for, but it's, I'd say, less than 5 times a year. And we also kind of over those 24 hours touch base with our transfer center because as I talked about that big catchment area, there's a lot of hospitals, asking our advice whether or not the patient needs to be transferred. So trying to kind of take care of patients who are not in our specific hospital.
Yeah. Sounds busy.
That's why you always see me in the hospital every time you're there.
That's
I'm
right.
there too.
Oh, now what sort of injuries are you seeing? I'm kind of comfortable taking care of like ground level falls and stuff, but you probably see like some high velocity.
Yeah, I'm usually dealing with mental trauma,
Mental
being a
trauma.
comedian.
Yeah.
So.
Oh, yeah.
I don't know if Dr. Kate can help with that.
Yeah. Well,
That's what I'm here for.
It actually, the broken bones can sometimes be attached to some mental trauma
I'm
as well.
sure.
So
Right.
we do play the role of psychiatrist here and there. But yeah, we as orthopedic traumatologists at our hospital, we take care of fractures, dislocations, infections. Other than the spine and other than the wrist and the hand, that is kind of our purview. So
those are complicated enough that they require like their own specialties on top of this specialty, right?
Yeah,
Like a hand
yeah,
surgeon.
the specific training.
Yeah.
Some traumatologists do wrist surgeries, but we just happen to have a really great hand and upper extremity team that take care of that for us.
Nice.
But I would say a traumatologist specializes in periarticular injuries. What I mean by that is joint injuries.
Ah, okay.
Periarticular.
Periarticular.
Vocab word of the day.
And we do take care of things like ground level falls, but we also specialize in high energy trauma.
Okay.
Open injuries, meaning the bone has come out of the skin.
Cool.
And then pelvis and acetabulum is again a traumatology.
What's the acetabulum?
Acetabulum is the cup of your hip joint.
Oh,
Okay.
Yes.
we should ask.
Yeah, you should.
Yeah.
That would make it one. Did you know that word?
I did not.
Acetabulum?
I had no clue what that word meant. And I'll be real with you. I'm not real queasy when it comes to like the medical TV show stuff. But the one thing that always gets me is when there's a bone protruding from skin.
Yes.
It's just there was one episode of The Pit recently where like someone had a dislocated shoulder and the bone was coming out of their armpit, and that
kind of got you.
I was like, nope, can't do that one.
Yeah.
I'm not queasy, but I had to cover my eyes. I was like, this is so much.
Yeah, I don't mind that stuff, which is probably good in my line
I was
of
about
work.
to say, if you're dealing with that on a daily basis,
Yeah.
I hope you're not queasy
but
about
there's
it.
other things, that other surgeons take care of that they're like, oh, no problem.
Yeah.
Oh, that eye's just hanging out of the face. And I'm like,
Yes.
I have to cover my
Yeah.
eyes. I
They have to move the eye
get
around.
queasy.
To
I'm like,
fix.
I have to go do surgery. I'm going to walk out of the room. So we have our things that we can handle and things that we can't. So
Yeah, that
And you
would
called
gross
me a
out.
comedy hero. You guys are the real heroes, okay? You deal with the stuff that so many people couldn't even look at.
Yeah, some of the docs have to move the eyeball all the way to fix the
Cool.
orbit of the eye.
Yeah.
I'm good.
yeah,
I'm good.
I'm good on
sounds
that too.
awful.
Yeah.
Now, Dr. Kate, what is an open fracture? How is that different from as far as like treating it or potential complications from an open fracture?
Yeah. So, we really, even if it's not open, I think about a broken bone. It's a soft tissue injury that happens to have a broken bone inside of it.
Okay.
And this soft tissue injury happened to have the broken bone come out of it. It's the traumatized skin. I guess it can go one of two ways. You either get the skin closed and it heals, which is fantastic, yay, or the skin does not heal. I think I have a conversation with my patients that the injury may look one way on day one, but then you take a look 2 or 3 days later and it looks completely different because there's an evolution of that soft tissue injury. And sometimes it requires us to contact our plastic and reconstructive team for management of soft tissue transfer versus skin graft. So it just kind of can elongate and complicate the course of
Extent of
fixing
the
their bones.
injury and
Yeah. Mm-hmm. Yep. So
an infection now comes into play.
yeah. And when I'm talking to my patients, I say stabilization is part of the procedure, but the main reason we're doing this today in an urgent fashion is that we need to clean and wash the bone and trying to minimize that risk of infection. But that really starts with our emergency department providers, and then kind of cleaning out
Antibiotics right away.
cleaning out the wound as best they can in the emergency bay and getting them on antibiotics immediately.
And now they're kind of saying, as long as you do it kind of within the first 24 hours, I think, depending on, unless it's grossly contaminated. But it used to be like, a little poke hole and like, oh, we got to go to the emergency room or the operating room right now. But
Yeah, that used to be a middle of the night thing, and that's just not the case
we
anymore.
don't do that.
But to your point, grossly contaminated, that's...
Yeah, a little different.
Yeah.
If it's in like on a farm in a barnyard or something, might be a little different. But
And
If it deals with tetanus, then yeah.
that's right.
yeah, it's kind of like the golden rule too. If my leg was grossly contaminated, I would want someone coming in the middle of the night. So
Yeah, that'd be nice.
yeah.
That's a good litmus test.
Yeah.
Would I want someone? Yeah.
Yep.
All right. And how do you coordinate the care with all those other specialists and such? Like if a trauma patient comes rolling into the ER and there might need a vascular surgeon or a trauma surgeon or plastic surgeon, who kind of coordinates all that, or how do you do that?
Yeah, so the general surgery team is, like I said, they're in-house team, so they're really quarterbacking the care of the patient from the moment they hit the emergency room to discharge. And so, they kind of start with a workup, and they have a great understanding of what is immediately threatening to the patient and what can wait. And like I said, a lot of the bone stuff can wait. And I think what's really nice about working at a smaller hospital versus some of the larger academic facilities that we trained at is I know everybody. I have their cell phone number.
Nice, good.
We sit in the surgeon's lounge together. So, you have a relationship with everybody. And, I can just text anybody or call anybody and say, hey, I know they have this orthopedic injury, but are they safe to go to the OR from your standpoint? Again, we have a great group of mid-level providers, both on the general surgery and the orthopedic side that help manage and have a lot of those conversations while we're doing our work.
What's a mid-level provider?
So those are our physician assistants, nurse practitioners, I guess they call them physician extenders,
Okay.
who are not directly in the operating room and can manage a lot of the care while we're working.
Awesome. Very integral into their patient care.
Yeah.
All right. Well, thank you both for that. Let's get to, we got to pay some bills here. So, ad read. Thank you, team. It's time for some common sense healthcare ads. This episode of the Dr. Ben and Friends podcast is brought to you by Whirly Rodeo. Tired of chronic back pain? You need Whirly Rodeo. Just strap this old ceiling fan to your lower back and crank it to high. The rapid spinning realigns your vertebrae through sheer centrifugal force. Makes you dizzy enough to forget the pain. Select your very own favorite Nashville tune as you spin. Order now and get a free barf bag. Warning, may cause permanent twirling. Enter Dr. Ben Comedy at checkout for 25% off your Whirly Rodeo.
I've been to enough chiropractors. I feel like that actually would work.
I know. I was thinking to myself, I was like, it's not as crazy as hanging upside down.
Yeah.
Right? Equitable.
I'll try everything once.
So, what's kind of the more rewarding parts of your job, or what? Do you have any specific examples, or what from kind of day to day that?
Yeah, I think the day in, day out rewarding thing is working with the teams that I have in the operating room. We work with a lot of first assistants, and that just teamwork, that team mentality. After I'm sure we'll get into this, but after I stopped playing ice hockey, that was something, I missed that team mentality. And I think orthopedic trauma from, like we just talked about, working with other groups and physicians in the hospital to working with our teams in the operating room. It's just, it's a wonderful thing to have a really good time at your job while taking care of really sick people. And I think, when I know that I have a great team in the operating room, I know it's going to be a great day. And there's no place I would rather be than with that team. And from a patient standpoint, we take care of patients who are incredibly hurt, multi-system trauma, head injuries, chest injuries, abdominal injuries. And sometimes, their entire time in the hospital, I actually never see them awake. Having some of these patients walk into my clinic, sometimes the first time they're there, they're on a stretcher. The next time they're in a wheelchair. The next time they're walking, all of these things, just seeing them evolve through their care and get better. Those are really amazing moments. And the best day is really when you discharge from your care and you say, call me if you need me. So it's, at its core, we're just helping people try and get back to the lives that they want to lead.
You're like Kim Possible over there. Call me BP if you need me.
That's right.
I actually had a co-resident who that was their pager.
Oh, nice. I love that.
I love it.
Very empowering.
Let's see. Motorized scooters are very popular here in Nashville.
Oh, my
Do you see any
God.
of those injuries?
Oh, yeah.
Okay.
I bet a different hospital in town sees those because it's right downtown.
Yeah.
But I will, I live downtown, and just the other day we were walking to the Ryman for a comedy show, and it's pouring rain, and some guy just at a hugely busy intersection just zooms, takes a left-hand turn with oncoming traffic in the rain, and I'm like, oh
You're going to be a
My
patient.
God. Yeah. So those things stress me out.
Yeah, I can imagine.
I know they're fun. I get it. I've done it before. But the further I get into this job, I do
You
not.
see the aftermath.
Yeah. The
Same
bikes,
with
the bikes I feel like are a little safer, maybe.
Okay. The
I don't
e-bikes
know.
or the...
Yeah. Well, no, not the e-bikes.
Okay.
No. The Lime bikes. I feel like those have like a mile per hour you can't go over,
Okay.
but those e-bikes.
There's
ooh.
that, but the
It's
Lime
like a motor-
ones
it's
do
like a
also have a
motorcycle.
little bit of a motor, so it's a little easier to. But I don't think it ever gets above like 15 miles an hour.
Yeah. But those e-bikes,
I don't
that's like a motorcycle in
Oh
disguise.
yeah, some of those could get up to like 30, 40 miles an
Yeah,
hour. It's
that's-
crazy.
Probably
Yeah.
riding around without
People just don't
helmets.
realize
Yeah.
we're just little bags of water. We don't stand a chance.
What about motorcycles?
Oh gosh, don't get me started.
You probably see some motorcycle injuries daily when it's...
Yeah, I mean when the weather starts to
Hourly.
get, and that's the weather in Nashville. It stays motorcycle weather like 9 months out of the year. So and I used to ride motorcycle. I used to have my motorcycle license, and
okay.
I rode a
So you
little
understand
street
the
legal dirt
enjoyment.
bike to work, and
I was a little bit of a bad girl myself.
yeah.
Then what happened?
Then I became an orthopedic traumatologist, and
You see,
some of the worst injuries extremity injuries, head injuries, come from motorcycles. And those patients, they always ask me, "Hey doc, when can I get back on my motorcycle?"
wow.
And
that's amazing.
so it's a way of life, and I have to support them in their decision. But it's it can be a way to get hurt, and it's also not often the motorcycle rider. It's just there's a lot of drivers out there that aren't used to kind of looking for motorcycles and things like that. So,
are there any other activities that have been completely ruined for you being in this field?
Skiing for me, but downhill skiing. But
Oh, okay.
yeah, I guess I wasn't a big downhill skier.
I've never been
Anyways,
skiing.
yeah, but that's bad.
Yeah.
Yeah, that can be bad.
you have a partner with a bad knee injury from skiing. so-
Yes. I think that was one of the questions that they asked me, like between fellowship and when I started. They asked me if I was going on any ski trips. I said no, which I wasn't, but I didn't tell them that I was going to hike Mount Katahdin in Maine,
Wow.
There you go.
which in its own way is a very dangerous activity. You can Google the Knife's Edge, which is an
nice.
amazing trail.
Yeah.
And you hike that one?
Oh yeah. Didn't get hurt. Everything was fine.
Nice.
But no, I think, I guess if I really like thought about it,
Yeah.
like driving a car, I should be afraid to do that.
Right. A very
But I'm
dangerous
still-
activity.
I
It's
still
only a
have my-
4,000-pound piece of machinery that goes 80 miles an hour.
Exactly.
Like, no big deal.
You'd think I would
What's
drive like 15 under the speed limit, but I'm going to be honest. I drive a little too fast. Yeah.
Have you ever had to tell law enforcement that you're a doctor and you're on your...
I haven't.
emergency
I have had my white coat in
Okay.
the passenger seat,
Okay.
and
But
the
she
guy.
speeds for the game, okay? She doesn't speed because she needs to. She
Yeah.
speeds because she wants
Need
to.
for speed.
Yeah, and he was like, "Oh, I hate giving doctors tickets," and he handed me like a $200.
But did it anyway.
Yeah, I was like, "Wait until I see you in the ER, man."
I really don't want to do this, but
Yeah, I really hate doing this.
Slap
I was
him with
like,
a
"Then don't do
$20,000
it.
bill.
Then don't do it, man."
Right.
But
like my parent punishing me.
Yeah.
I really don't want to do this, but
Yeah,
I need to.
I've never.
You have to learn a lesson.
I've never been pulled over actively trying to get to the hospital, so I haven't tried to use that excuse yet. But I'll let you know when I do.
Dr. Kate, so what drew you to orthopedics? Why orthopedics and why traumatology? What drew you to those?
Orthopedics, it just made a lot of sense to me. I loved anatomy. I took this awesome evolutionary anatomy class. Man, it was about primates, but it's still just the bony structure, the interplay with muscles, and what does that have on function? I think being an athlete too, you're trying to hone your specific muscles to do your job, whether that's a football player, hockey player, softball, whatever it may be. And I also really like 3D spatial things really like click for me. So everybody like, oh God, organic chemistry. That's like the hardest course out there. I loved it. I thought it was
okay.
rather simple. Not simple, but like, you're,
Smart one here.
I was about to say, we get it. You're smart. Okay.
yeah, but I mean, it's just
Flex
like
much?
I failed 2 out of my 3 levels of physics in college.
yeah,
Okay.
it's a specific smart though, right?
Right.
It's like I'm a very like knife's edge smart.
Okay.
Like my twin brother is like globally
Okay.
genius,
Okay.
like very smart in like a lot of different things. So I stay in my lane. But so kind of putting those two things together, orthopedics just made sense. And, going into residency, I was like, I don't really know what I want to do. I think a lot of early residents get drawn to trauma because they like let you do things. It's very, you can't mess things up too much.
It's already messed up.
Yeah, it's already messed up. Like, go try and put a splint on it. You're not going to mess it up too much.
Right.
It's like worst comes to worst, you pull it off, but
Yeah, we'll put it back on. And even in the operating room, they're like, you want to put this screw in? And you're like, yes.
Yes, I do.
Yeah, it's like a screw that doesn't
That's
matter.
a big deal. Like as a med student, they're
Yeah.
like, you brag about it. Like,
Yeah.
Dr. Kate, let me put a screw in.
Right. And so, you're just like, wow, this is awesome. And so I had to contend with like, do I like trauma because, they let me do things? Or do I like trauma because I like trauma? And I think ultimately, not to sound like too much of a hippie here, but it's like an energy thing. Like what can you dedicate yourself to for 12, 14 hours a day and not be exhausted at the end of the day? And trauma was it for me. I loved the surgeries. Yeah, sure. But, that half of it is talking to patients. I just felt like you could have pretty realistic conversations with your patients about their injury, about their expectations of recovery. In a way, I guess it's more paternalistic than a lot of other parts of medicine because you're like, hi, my name's Dr. Kate. Your femur's broken. We're going to fix it. And people are like, okay. They're not going to be like, well, like,
what are my other options?
Yeah, I saw this like ad on TV. Like they're not going to, argue with it a whole lot.
You sure this can't be solved with Ozempic?
Yeah, exactly. So I appreciated the patient interactions to have kind of those realistic conversations.
How does the human anatomy compare to the primate anatomy? Like which primate would we most closely resemble, do you think? Is it very similar?
Well, I every time I think about this, it's really about the crest on their skulls.
Okay.
About their mastication muscles, like why a gorilla can, bite through whatever they bite through. I don't really know what they bite through.
Strong.
Yeah, hard things.
Hard things.
But it's that the origin and the insertion of those muscles that allow them to do that. So I feel like we're a lesser monkey than a gorilla.
Okay.
I guess I don't know my monkeys well enough to really.
I just wondered.
I always
if
hear
it
that we're
compared-
like closest in most things to the bonobo chimps.
Yeah, I was gonna say
Okay.
a chimpanzee of
Yeah.
sort. Yeah, just evolutionarily.
Yeah.
Yeah. But physically, I don't know where we
I was
fit
just
in.
curious. Yeah.
Anatomically, I'm not sure.
She's not that kind of scientist,
Yeah.
okay?
And then you like the 3D spatial arrangement. I'm curious as to like what role technology plays in both your practice now and where do you think it's headed, or
Yeah.
is it going to take over our jobs, or
I
like
don't-
AI and robots?
I mean, it might take over your job.
It might.
Oh,
Yeah.
shots fired.
But
It could.
I don't think
That's
it's
why
going to.
I have comedy as a backup.
Yeah, it's smart. I don't have a backup. So,
How do you use
I
technology in your job?
Yeah,
today?
I think the technology really comes from our implants, and there's kind of new variations on some of the big strides that came forth in the 70s and beyond.
Like nails and plates.
Nails, plates. I think in the 90s, like percutaneous pelvic fixation. Like, what's that? How has that changed our practice? It's immense for taking care of patients with kind of bigger pelvic ring injuries and things like that.
Just through the skin, percutaneous, not big incisions.
Small incision, not a big open, big whack, as you might say.
Big whack.
I think, we're always kind of standing on the shoulders of the giants that came before us, allowing us to do the things that we can do through more, I'm not going to say minimally invasive, like minimally invasive sounds like you're making just like a little thing here
Right.
and there, but like that's not
Less invasive.
less invasive.
Less invasive.
MIS does not, it's not an orthopedic trauma term.
Right.
So, I think a lot of technology comes from our implants. Robots are not a thing that we really
For trauma.
use.
Okay.
Yeah. So nobody is in the emergency bay being like, hey, doc, you're going to use a robot for
Robotic.
this.
Right. Whereas
No.
general surgery and other areas of orthopedic surgery.
Yeah. And I
robots are
think,
used.
I got to use some of the robots for hips and knees and in residency, and it's amazing technology. It's just not really helpful in the variety of fractures that we take care of. So I think a lot of the technology, maybe in imaging, our CTs. There's a lot of software out there that can show you 3D reconstructions of a lot of the
That's amazing.
injuries you're taking care of. So it helps you visualize, exactly what approach you want to do, where you want to maybe put a plate. There's even some software out there that you can actually put plates and screws,
Oh, wow.
kind of on top of these 3D images to kind of, again, have a better
Preoperative
idea of your
planning.
plan. I don't use that much, but you can.
It's out
Yeah.
there. But yeah, that 3D reconstruction of a CAT scan is amazing.
Mhm,
They can take any body part and 3D image it
Oh, wow.
Yeah. So for acetabulum or the hip
or
socket.
the socket.
Oh, right.
Yeah.
Okay.
So that it's really helpful for that. For elbow fracture dislocations, I think it could be
All the
helpful.
pieces. And
Yeah. Proximal femur fractures. Yeah. I think, yeah. I would say my generation versus some of my senior partners, they don't get CTs as much as I do. I like to be in the know. I think it just helps me plan. So I'm an over CTer perhaps.
So in the future, there'll be
Yeah.
there'll be orthopedic traumatologists, humans, and then a bunch of robots doing all the other
Yeah.
surgeries.
Yeah, I mean, like deep down, if I think about it, like what AI can do, like maybe you feed a tibial plateau fracture into, a robot and it can do it better than I can. Maybe
Maybe.
that's where we're headed, but we're not there
Hopefully
yet.
not in our
Yeah, so
during
I think
our careers.
my career's safe right now.
What
Or-
a crazy world that would be, going to the doctor and you feel like you're on the phone with Comcast and you're just like, can I please talk to a real person?
Yeah. Just hit
Please.
0, 0, 0, 0.
Yeah.
Operator.
Can I get to a real?
You just say something like totally gibberish so that the robot's like, let me connect you with an actual
With a human.
surgeon.
But maybe they'll triage and
Yeah.
say whether it needs to be transferred or not. Or,
Right. Yeah.
Okay, so what is triage? I've heard this term a
Oh,
lot on the
yes.
pit, and I don't know
Oh,
at all what it is.
What's triage?
Well, I'd say like what is most pressing.
Okay.
Right. So like if you come in with like a nosebleed
Yeah.
that started 1 minute ago and you've been able to stop it, like you're low on the triage board.
Okay.
All right. You come out, after getting shot in the stomach.
Yeah.
Like, yeah, you're higher on the triage
Okay.
board. So, it's just kind of
the
like,
hierarchy of care.
yeah, it's like who needs to be seen like much faster than other people,
Okay.
essentially. Yeah.
Okay.
Yeah.
That makes sense.
Kind of seeing what's emergency, what's not, what can wait,
Yeah.
what can.
Which,
Okay.
like, going back to the pit, if you see all those people in the waiting room who are like, I've been here for hours,
Yeah.
right? They're low on the triage board
Right.
versus people coming in from the EMT,
Yeah.
fell or water park injury. It's the most recent episode. I don't know if you've seen it.
I have actually.
Okay.
Yes. No, I'm caught
see?
up.
All right. So, yeah.
My mom renewed the HBO Max subscription, so I was like, let's go.
Yes.
I like it. I like it. Yeah, that's a very popular show.
And now for a word from our sponsor. It's time for Common Sense Healthcare ads we wish existed. This episode of Dr. Ben and Friends podcast is brought to you by Burp Be Gone. Acid reflux or burping ruining your life? Try Burp Be Gone. Swallow a fistful of uncooked pasta and chase it with baking soda. That's what I do on Sundays. That's my Sunday dinner. The pasta absorbs the acid like a sponge, while the soda creates a volcanic eruption that neutralizes everything. You'll burp fireworks for hours. Fun at parties. Warning, your stomach might audition for a volcano. Burp Be
Listener,
Gone.
make sure it says Burp Be Gone. All others are impastas.
Oh, I like that.
Oh. to kind of switch gears here a little bit, did you have any more orthopedic questions or
No,
trauma?
this has been fascinating, though.
Okay.
Learned a lot.
Dr. Kate here, we're going to learn something new about too. She played both collegiate and professional hockey.
All right.
So
All right.
to switch
Back
kind
in
of
the
gears
day.
We are
here,
from up north.
I want to hear
Yeah.
from New Hampshire.
Yep. Yep.
So how old were you when you started playing hockey?
I was 9. So we had just moved to New Hampshire from kind of like upstate New York. And my mom was like, "What do people do around here?"
We got to get her
Well,
plugged
Yeah,
in
it's
somewhere.
like you move to
Canada,
a
so
town with like
hockey.
5,000 people, and then it's the dead of winter, and it's like real
do people
quiet.
do?
Yeah, what do people do up here? And the answer was ice hockey. So my older brother started the first year, and then my twin brother and I started the year after that. So I was 9.
Oh, you're a twin. Okay.
I'm a twin. Yeah.
Okay.
Awesome.
I was the only one that made it out of high school, continuing to play ice hockey.
Okay.
So.
And was there like, was it girls hockey or you played with boys or how that worked in New Hampshire?
it was only boys,
Only boys.
at that point. I started playing girls hockey probably in high school. I think, when you're younger, like the girls tend to be bigger. Like we have our growth spurt a little bit earlier.
Right.
But then you get into high school and you may be playing with guys who are 4 years older than you and who are 6'2"
pounds.
and 180
More
pounds,
than you.
if not more. And it's a hitting league at that point. And so kind of around that time, I transitioned to playing girls hockey, both for a club team, and then my high school team was girls only as well.
Which women's hockey's kind of making a comeback
Oh,
right
huge
now.
rage.
Like,
Especially
it
with the
was big in
Olympics
and the
Olympics.
US.
Yeah.
Yeah, yeah.
U.S. beat Canada in women's hockey?
You darn skippy they did.
Yes.
Yeah.
2-1
Let's
overtime,
go.
very
Yeah, it's
dramatic.
fantastic.
Let's
Tell
go.
us, walk us through that game. That was a nail biter.
Yeah, I mean the tournament up to that point, the United States had been steamrolling everybody,
Nice.
like
As we
4-0,
should.
6-0. And so they were and they had beaten Canada 5-0 in the preliminary rounds, which I don't think Canada had ever been shut out in the Olympics ever
Wow.
at that point. So the United States team was just playing fantastic hockey. And, the gold medal game, it's a single game.
Yeah.
And Canada
All or
scored
nothing, win or go
early.
home.
And, then they were playing fantastic defense. Their goalie was playing well. And the United States was just getting shut down. But then with, I think, 1 minute to play in the third
The very
period,
end.
Hillary Knight scored this unbelievably beautiful tip-in goal.
Great individual
Nice.
effort.
Oh, beautiful. And that takes serious skill. I mean, and that's
How
something
crazy were you going watching that? Were you?
Oh, pretty crazy.
Yeah.
Yeah. I think
Wow, that was.
I I was supposed to be in the OR that day, but
Uh-oh.
I didn't have a ton of stuff, so I got home.
Go
in
ahead and
time.
get started without me. I'm watching
Yeah,
that.
yeah. I know. I was like, I probably would have had it on the OR maybe. But I was able to be home for it. And then, I mean, the overtime was just,
Wow.
and again, unbelievably talented, skilled effort to put that winning goal in. That was unbelievable.
I love it.
Yeah. I mean, it's a wonderful rivalry between the Canada and United States. I feel like in the women's side, almost more like the men's side. Yes, the 2010 U.S. Canada game was unbelievable. These are, they're all NHL players,
Right.
and they have another job, if you will. But I think the U.S. Canada for the women's side is the pinnacle of the game, and those games are just must be incredible to be a part of. So
And now Hillary Knight, you're not going to put you on the spot for your age, but she's in her mid 30s.
yeah,
So
Yeah.
does that make you want to lace up your skates or anything again?
not at all.
Okay. Not at all, she says.
Yeah, let's see. I stopped playing professional when I was in medical school. I played a couple games here and there. I was like considered a practice player.
Okay.
At that point, it was, let's see. I went through a couple iterations of professional leagues. So the
Okay.
original league I played in was the Canadian Women's Hockey League.
Okay.
All right. And so that was, you did not get paid whatsoever.
Okay.
Yeah. So I had a job as well. So I was a medical assistant in an orthopedic clinic.
Not a true professional.
Yeah. I mean, they paid for our like helmets and pants and
Oh, there you
jerseys,
go.
I guess, and maybe the bus that would transfer you from Boston to Toronto and Montreal.
They're taking up a collection for gas money.
Yeah.
Could everyone?
I mean, thankfully they flew us to Calgary, which was nice. And then I guess it was maybe the NWHL. I played for the Connecticut Whale as the practice player.
Okay.
Wait, the whale singular?
Yes, just a single whale.
Interesting.
Yeah.
Not like the Whalers.
Yeah, not the
like
Whaler.
Hartford
It was,
Whalers.
paying homage to the Connecticut,
Okay.
It was the same colors, but yes, the Connecticut Whale. And I was really, I was just helping out, when they needed an extra player. I was like, okay, I haven't skated in 2 weeks, but like I can huff and puff all the way up and down this ice. And then I moved to the pinnacle of my career, which was men's league in St. Louis. And that I played through fellowship with that. But since I moved to Nashville, I have not yet had a chance.
Okay.
Now, was this like a she's the man situation, or did they know you were a woman?
Oh, they knew I was a woman. Yeah. And they probably didn't expect me to like hit them as much as I did.
There was
it's non-hitting, but just a little physical here and there. So yeah.
There was a woman that played in the NHL exhibition game as the goalkeeper.
Yes.
Reem. But so that was now women's hockey that became an Olympic sport in '98.
Yes.
And the U.S. have medaled in every Olympics since.
Right.
That's awesome.
Right. Yeah.
This is our third gold. But
Nice.
Yeah. And
It's medaled
I
in
was
every-
1998.
when it
I was
became an Olympic
9
sport.
years old. Right when I started playing hockey. I mean, I remember sitting,
watching Nagano.
Yeah, just like we had like a main TV room in we had an old farmhouse in New Hampshire, and the main area with like the big wood burning stove, and then there was like another room with a smaller wood burning stove and like a little tiny TV. And I remember my brother's like, we're not watching hockey. I was like, I'm watching hockey. I just sat there watching them play. It's just unbelievable.
So you watched the '98 Olympics when it was.
Hell yeah.
Wow.
Yeah, 2002. I mean, yeah, 2002.
From then on.
Yeah. I think 98 and 2002, those are like the two memorable, like I was a kid watching like, wow.
That inspire you to want to pursue that?
Absolutely. Yeah. Yeah.
Because I can watch curling, but that doesn't make me want to become a professional curler.
I mean, I think,
but that,
I don't know. They don't have beers when they're doing professional curling. So I think like no one wants to be a professional curler because you want to have that ability to have a beer while you're doing that. Yeah.
I think we have curling here in Nashville. I heard. So.
We do have a bar that is actually a curling club.
Whoa.
Yeah, over in the Nations or like Sylvan Park, I think.
I heard that.
Yeah. Apparently it's really nice.
I mean, now I'm getting on my phone Googling. I bet it's packed around, like just post Winter Olympics. I bet you cannot get a slot.
Like if I watched the biathlon, I probably wouldn't be inspired to do cross-country skiing and shoot.
I will tell you that is my favorite sport to watch in the Winter Olympics. Yeah, because it is so,
it's amazing.
It's so grueling. It's like watching rowing in the Summer Olympics,
which is
absolutely
also crazy.
I can't believe how steady they are to shoot after.
Yeah.
I'd be like,
yeah. I mean,
amazing
looked like
athletes.
overly caffeinated, but I had a short stint with the national team, and soon after I was cut from the team, I went home, to lick my wounds, and we have a great cross country skiing course, in my hometown, and my mom was like, let's go cross country skiing. And that woman does that all the time. And I'm like, sure, skate skiing. I got this. I'm like, I'm in like an Olympic shape, you know,
but
huffing and puffing. I could not catch her. I mean, it was just, it's an unbelievably difficult sport. And
sometimes
totally
they're going uphill
too.
Yeah. Oh,
they're going uphill.
They're going uphill. Yeah.
Ugh.
Yeah.
No, thank you.
No. I enjoy watching it.
Yeah.
I do not enjoy
watching
doing it.
other people do very difficult things.
Yeah.
Like I love watching that show alone, and I'll be like cuddled up at home, like on the couch eating popcorn. I'm just like, man, that's crazy, bro.
Yeah.
You had to kill an elk? That's nuts.
Yeah.
I could do that better.
I love it. Any winter sports that you think you'd be drawn to?
I mean,
from watching the Olympics?
I mean, I do thoroughly enjoy watching curling, but I've never like had the inkling to just go and do anything curling wise. I do love like all of the bobsled variations. Like those fascinate me so much, especially just like because you've got the skeleton, which is just the one person. You've got the luge, which is the 2 people. The full bobsled, which is 4 people. Like, I don't know. It's just so fascinating. All they're using is gravity.
Crazy.
Yeah.
And you have a need for speed.
Yeah, some cool running.
I'd be like, where are the brakes? I'm going too fast.
It takes me back to when I was probably 4 or 5. My family went to Gatlinburg on vacation, and my dad decided to take me down those alpine slides. And he really wanted to beat my mom on the way down, so he used the brake very sparingly. And we definitely flew off the track at one point. I vividly, like I said, probably
you could have been a patient of Dr. Cates.
Yeah. I vividly remember, we got thrown off the track. I was covered in cuts and bruises and stuff. And we finally got all the way to the bottom and had to go like to the little medic stand that they had right at the end of it, which clearly they knew this was a thing that people are going to do. So needless to say, my mom
scared?
won.
Or were you like... exhilarated,
I
like, wow, that was cool.
I mean, on the way down to going off, it was fun. And then, I just remembered like being in pain.
Your life flashed before your eyes.
Yeah, my short little 4-year life. Yeah. It's not the first time my dad has injured me on some sort of sledding incident. There was one time we got a really big, because I grew up in Atlanta. Okay. And same as here, we don't really get a ton of snow down there. But one year we just got a ton of snow. So we didn't have any sleds. So my dad was like, let's get some contractor trash bags and let's just take them down the hill outside of our house. And same thing, hit a nice little bump and we flew and my dad landed on top of me. And I was probably 3 and I pulled my face up out of the ground. And I've just got like grass hanging out of my nose. Like, yeah. Yeah, there was a lot of those when I was a kid, just getting thrown off of things because of my dad.
That's why he loves the bobsled and luge.
Yeah. So I like to watch. I like to watch the sports and be like, I'm not going to get hurt doing this. So, yeah.
Did you guys hear about the ski jump scandal?
Oh, yeah.
There was a scandal.
The Norwegians,
Oh, yeah.
they were kind of enhancing certain areas in their nether regions, and it actually makes you fly further, believe it or not.
What were they enhancing?
Well, both areas on themselves as well as on their suits.
Oh, okay.
They did a study actually, even enhancing the suit 1 centimeter more material helped you fly 4 meters farther.
Wow.
So they were kind of,
okay.
A little scandal of people enhancing.
The definition of scandal is hilarious depending on who is involved. That is nothing I would have even considered to be scandalous, but that's amazing.
So, well, good. All right. Well, thank you, Dr. Kate and Mr. Seth. Dr. Kate.
Yes.
Kind of to little role reversal. Do you have any questions that you would like to ask comedians? You mentioned you were going to a comedy show. Anything about comedy that interests you? Or
who are some of your favorite
scenes?
comedians?
Well, we just saw Bridget Everett.
Okay.
Who's just, I guess I'm just going to say hoot. She's a hoot.
She's a hoot.
I'm trying to keep this PG-13.
Is she the redhead?
No, she's blonde.
Okay.
She's a bigger lady. She's burlesque. She sings.
Okay.
Mostly. So she has a band on stage.
Okay.
Yeah.
There's another girl kind of in that vibe, but she doesn't do the burlesque thing, but she kind of has the old school, like 1960s. I'm a comedian lady. She's utterly, I can't remember her name, but she's utterly hilarious.
Yeah. So Bridget Everett just had a HBO show, Somebody Somewhere.
Okay.
I don't know if you ever saw that. It's very good.
No. Okay.
It's not like a comedy show.
Okay.
Let me just preface that before you get going. I mean, we don't go to comedy. I mean, this is such a music city, right?
Yeah.
But we've gone to Zanies a couple times. I want to see you, Dr. Ben.
Oh,
obviously.
Dr. Ben is at Zanies.
Plug. The Ryman. We went to the lab at Zanies for a psychedelic comedy show, which I was just like curious about it. We probably once every 2 months try and get to comedy.
Nice.
I think it's actually a pretty good showing here in Nashville, I have to say.
No, we get quite a few amazing people coming through here all the time.
Yeah. So I never went to comedy in St. Louis.
Okay.
I just don't know if I wasn't looking for it, or they just do a much better job of advertising here. Because isn't there a whole comedy festival coming to the Ryman?
Yep. I mean, it's the Ryman, Bridgestone, bunch
Nashville
of venues
Comedy
around
Fest.
the city.
Yeah. But I mean, I look on stage and I say, wow, that's something I could never do.
Never do? Okay.
I'm sure people would say that about my job, but I'm in my own world. I'm in a little hole in the ground in the hospital. There's some music playing. Bones are getting fixed. It's a very zen world.
Zen.
But being up in front of people,
No, thank you.
oh my God.
Yeah.
No, I just would, my voice would start shaking and I'd probably start crying. So I'm impressed that
terrifying.
you do both. I mean, you have like your zen world, on
In the operating
stage
room.
and in the operating room. To me, it's a very different reality. So,
Oh, absolutely.
yeah.
I've been asked before what was scarier, performing my first surgery or performing my first stand-up routine, and it's definitely stand-up comedy.
Yeah.
That's terrifying.
Yeah. I mean, no one's clapping in the operating room.
Right.
Yeah.
Like the worst thing that's ever been said is, wow, I've never seen that before. We have implant reps
Right.
and they've been around the
I've never
block. They've
that.
seen a lot.
If you hear that.
Yeah, you're like, oh God, like what did I just do?
Or I'd have attendings and training say, I've seen it done better, but never slower.
Yeah. There's a lot of
We're
hard
gonna replace
learning.
we're gonna replace the clock with a calendar.
Yeah, but it's you're not responsible for like an audience,
Right.
which I think is very different.
Sometimes there's heckling from anesthesia.
Yeah. But we can give it back.
That's right. It's back and forth.
But yeah, so it gives me just like heart palpitations even thinking about being on stage.
See, I'm always fascinated to hear that because I basically was born on stage. Like I have never felt more comfortable than when I am either acting or doing stand-up or playing music, like whatever it is. I've been acting since I was 6 years old. I have been wanting to do stand-up since I was 3. And like vividly remember memorizing like old school, like Bob Newhart, Bill Cosby routines and like standing on a chair in the kitchen, like reciting them for my mom while she's making lunch or something. Like,
wow.
So it's always felt so natural for me. I'm always nervous, like right up until the moment I walk on stage. And then it's like, yeah, this is where I'm supposed to be.
Yeah, Steve Martin's book is called Born Standing Up. I think that applies to you.
Yeah. Absolutely. Love Steve Martin. His stand-up is some of the best still to this day.
Yeah.
Like it's my favorite of his was just seeing him on the Muppet Show. I don't know if you ever saw that episode, but the episode itself is funny because the framework of that one was they scheduled the show for the wrong day and it was actually audition day. So they send the audience home. So there's no laugh track for the whole episode, but Steve Martin still comes out and does a bunch of his routines because it's like, hey, I'm here. Like might as well.
Right.
And all you hear is the laughter of the actual crew from the show because Steve Martin is just so funny.
Oh, he is.
Wow.
Oh,
I guess I do have a question for you.
Yeah.
Okay.
All right. So in the operating room, like things aren't going well, right?
Okay.
You got to switch gears. You got to do something else. Like if you're not getting the reaction that you're maybe expecting from the crowd, like do you have like a backup, like this joke always hits, or like how do you because a lot of you guys are storytellers, right?
Yeah.
So like sometimes I think some of the best comedy shows out there, it's like a long flowing story that somehow circles back to itself.
Absolutely.
So like if you're in the middle of the story and it's just not going well, like how do you switch gears if that's even possible? Or do you just like let it ride?
It really depends on what I've been hired to do, where I am in the show, and how I feel like it's going to affect the rest of the show. But the other part of it is you kind of have to gauge whether or not the show will actually be able to be salvaged.
Okay.
And I have two directions that I go whether or not I think the show can be salvaged or not. And one of them, yes, I do have a few jokes that I'm like, these always hit. I can do these real quick and then get into a story and then things will usually ride out from there. Mm-hmm. But there have definitely been shows that I have gone to where I could tell before I even get on stage, like this is not ever going to go well at all.
Just like no smiles in the crowd whatsoever.
No smiles. No one cares. There's a football game on, so everyone's watching that. So I actually have a story that actually relates to medical issues that I tell. I tell this story, and I don't use her real name because she's requested I not, but my friend Natalie is what I call her. Mm-hmm. She was a nurse's assistant. She's actually a full-fledged, like she's doing her residency up in Louisville right now, but she was a medical assistant at one of the hospitals here in town. And she told me about this story about a guy who came in and his bowels were so impacted he hadn't gone to the bathroom in 2 weeks.
Oh,
And I won't tell the story on here because it's very traumatizing for people who have not ever been involved in this side of medicine before. But ultimately, he died, and something else very traumatic happened that affected her and the family and everything. So when I know there is no hope to save a show, I tell this story. And then I go off stage and I'm like, I am done.
okay.
Yeah. So you can just call it. You can just be like, I'm done.
Call it.
This is I can close this out and say I did my job, but there's no way I'm going to try to waste my good jokes on these people. So let's give them a little trauma to make sure they laugh next time.
There you go. All right. Very fun. Now I know.
Yeah.
So if I'm watching a football game and I hear, out of the stage to my right, something about a bowel disimpaction being needed, I'm going to know it's you.
Yeah, exactly.
That's right. And I think for me, we're kind of like scientists, and it's always an experiment up there. And so just because experiment doesn't turn out the way you want doesn't mean it isn't going to work or doesn't work. Or so it's like, well, let me try it a different way, or was it, let me mix it up a little.
Yeah.
So you're kind of like seeing what works, what doesn't, experimenting up there. And so you kind of take it from that, like, well, that bombed, I'm never going to do that again, throw it away. Or you're kind of say, well, how can I tweak that? Or
yeah. The only truly bad shows are the ones that you just can't learn anything from. Mm-hmm. Like, I don't consider it a bomb. Even if I do truly bomb, I don't consider it a bomb if I get something out of it. Mm-hmm. If I realize I'm like, okay, I need to never say this way again. Mm-hmm. I've learned something and it was a successful show. Whether or not people enjoyed themselves, I still got something out of it, so I can fix things for the future.
Yeah. How often are you doing shows? Because I think I do hundreds of cases per year, right? So in a perfect world, I'd be able to reflect on each one of those. But I don't have time sometimes.
Yeah.
But how much time do you have between shows to be like, okay, I'm going to sit here with my cup of coffee in the nice shining sun?
It really just depends on how hard I'm hustling. At the moment, I have other artistic endeavors I'm pursuing. So stand up, I still do it. I still go out to open mics and still try to book shows here and there. So I've got some stuff popping up here and there. But when I'm actively hustling, I could have 3 shows a week.
Oh, wow. Okay.
On top of open mics, which are open mics are our version of rehearsals. The only way stand-up is weird in that you can write all you want. You will never know if a joke is actually funny until you say it on stage in front of people. Mm-hmm. So it's very different from music, where you can write the greatest song that's ever been written and no one's going to hear it until the day you put it out. Mm-hmm. And it's still the greatest song that's ever been written. With a stand-up joke, you have to perform it a number of times in front of people. And so the lowest stakes way to do that is just go to an open mic where everyone already expects you to be bad. So you can kind of just say whatever you need to say to get the joke out and learn how you're going to need to phrase it so that it works every time after that. Yeah.
And I'm encouraged too to hear stories from the all-time greats that should be on Mount Rushmore of comedy, tell their stories of performing in front of silent rooms, bombing. Oh, yeah. It's they've all done it. So
the first open mic that Zany's held when the lab opened, Nate Bargatze came in and did the first set, and he bombed the whole thing. And he finished his set by looking at everyone and going, good to know 22 years later, open mics still suck. They're still the absolute worst. But he popped into the East Room at one point because he had 20 minutes he just wanted to run. And it was so educational to watch legitimately the number one comedian in the world right now going through the exact same process that I go through when I'm at an open mic. You could see when a joke didn't land, because a lot of us will have our phone up there or a notebook up there to be able to just refer back and be like, okay, that worked, that didn't work. Mm-hmm. He was doing all of that in his head. And I could tell anytime a joke didn't work, he would just move his head very slightly in the same direction every time. And I could tell that was him crossing that joke off and being like, nope, not going to work. Can't do it again.
Wow.
Yeah.
Some people, like you, say, I could never do that. And then sometimes you hear people they see other people doing it and it looks easy to them. I could do that. I'm funny. And so I encourage those people to try an open mic. You probably hear those.
So many times. I've had so many people tell me.
I could do that because they make it look easy.
Oh, yeah. Well, especially on Broadway, all the musicians down there think they're comedians. No matter how many times their stupid joke bombs on stage, they're back the next week doing the exact same stuff, bombing even worse. And they all look at me and they're like, "Oh yeah, I could do that." And I'm like, "Okay, cool. There's an open mic tonight. Come with me." And they're like, "Oh, I don't know. I'm busy tonight." I'm like, "Okay, well, there's an open mic every single night. Just tell me which one you want to go to, and we'll test your theory."
I'm here to say I respect your craft, and I do not think it's easy.
The respect is mutual.
We won't see Dr. Kate at an open mic.
You will not. I mean, audience,
to watch.
Maybe the audience is
In
not
the audience,
laughing,
but not on stage.
Yeah.
All right, folks, that's a wrap. Dr. Ben here. Keep those vital signs stable and those jokes sharp. With Dr. Ben and friends from the heart of Nashville, we're celebrating healthcare heroes like Dr. Kate and comic pros like Mr. Seth. Remember, we can be serious in surgery, but some of us are seriously funny. All right, if you love today's episode, celebrating comics and healthcare heroes, join the team Dr. Ben, and hit that subscribe button. You can find us on YouTube, Spotify, Apple, Amazon, anywhere you get your fine podcasts. And your word of mouth is our best support. Tell a friend, your doctor, your nurse. All right, we want to hear from you, listener. So send us your favorite dad joke or comment. We can't wait to feature you in our next episode. All right, Mr. Seth, you're very impressive. I can't believe you do all the things you do. There's not enough hours in the day for all the plates you keep spinning. Where can our listener follow you or find you?
Yeah, so on Facebook, it's Seth K's Comedy. That's Kays. That's the first word I ever learned how to spell because growing up, whenever my mom was on the phone, it was always K's, Kays. So Seth K's Comedy on Facebook, Seth K's Official on Instagram, and follow the Movie Wars podcast. We're trying to get our YouTube numbers up, y'all. So let's follow it on YouTube. Follow us on Instagram. We got some great stuff coming out over the next few months. So I'm very excited.
All right, love it.
Yeah.
Thank you, Mr. Seth. And Dr. Kate, I don't think you want people finding you. If they do, they're having a bad day. Any tips you can give?
I'm very sorry if we meet, but
Any
you know,
tips you can give
you're
the
in good
listener?
hands.
At least if you see her, you know it's actually going to probably turn out okay.
But what tips could you give the listener so they don't see you? Anything you want to?
You know, I just life happens. So it's, I think a lot of people are like, I shouldn't have done that or I should have done that. But you know what? Live your life. If you see me, you see me. Hopefully it's out in the wild and not in the hospital. But, you know, if you break a bone here in Nashville, you're going to get very good care.
That's right. Well, thank you both for having us. Thank you, listener, for joining us. All right. Stay healthy, y'all.